So instead of looking at this broad versus narrow, how I recommend we look at human security is first to recognize that there's no difference in the cause of death. The concept of security shouldn't prioritize, but also that the concept has to be selective. If we're taking all threats to all people in all places, it just literally doesn't work. So human security then becomes the protection of the vital core of the individual from critical and pervasive threats. And here there's puts 3 severity thresholds on the concept. So in order to be considered a human security threat, a harm in any one location has to cross these 3 thresholds. One is a threat to the vital core, and this means that it actually has to threaten lives. So threats to human dignity, like some organizations argue should be in human security, I think don't cross that threshold. They actually threaten the lives of people. Second needs to be critical, which puts a time frame on it, so there has to be an urgency to it. And it has to be pervasive, meaning it has to be widespread. It's not just affecting one person in one location. This then limits threat inclusion by cause rather than severity, or not by cause, but by severity. So instead of taking all environmental threats everywhere and saying they're all human security threats, it says in some locations, some environmental threats may cross the threshold and should be treated as if they were a security issue. That's a distinction. So some, but not all conditions in each UNDP category, each of those 7, in any one location, it's spatially determined, which is important, and I'll go into that in a second, should count as a human security threat. It also separates threats, causes of threats, and mitigating mechanisms. And this is another problem within the human security literature, is these often get conflated with one another. And I think it's really important to keep them separate. So example, a threat might be, threat's what's the actual end condition that harms somebody. So that might be an outbreak of malaria. The cause of the threat might be, say if we were taking malaria, might be living in a proximity to an infested water source, and a mitigating mechanism might be immunizations or mosquito nets or whatever it might be. That's the policy outcome. I think we have to separate these 3 when we're looking at human security. So if you take that threshold, how then do you assess that threshold? And how do you go from the national level health outcome data or excess mortality data that is incredibly difficult to both calculate and isn't of particular use to humanitarians, to the local needs assessments that humanitarians use using the concept of human security? So is this a useful term or useful frame of reference for these local needs assessments? And a few people have tried to measure human security, but there's some problems with all of them. Again, this is just the indicators across the spectrum that each of these methods use. And you get a similar thing to what you get with the definitions. It's very scattershot. People have different indicators across the spectrum depending on largely what the mandate of their research project is. So health, for example, a health-based methodology, of course, focuses on health-based indicators for human security to the neglect of the other potential human security threats. There's some problems with each of these methodologies. One is that the closer you get to a broad definition of human security you're trying to measure, the more correlated you become with human development, the Human Development Index. The second, they're each, again, victim of the paradox, that the broader they try to be, the harder they actually are to do. They have indicator selection problems. So how are they choosing these indicators? Are they just grabbing the ones where there's data, or are they choosing ones linked to the mandate of the research organizations? And finally, data aggregation. They all use only national level data. So a threshold-based measuring process would determine the threshold in a particular region, figure out what the threats are that cross that threshold, and then measure and map them and spatially analyze them. And this is what I'm going to go through briefly. So we start with the concept of human security. We divide it into our 7 categories that the UNDP outlines. And we try and find out for any one country what threats cross that threshold, cross those 3 severity thresholds. And this is from a case study in Cambodia, and these are the 13 threats that were overwhelmingly considered to cross that threshold. Data was then collected from local organizations, from local NGOs, from international organizations, from government ministries, to capture each of those threats at the local level. And these are examples of some of them. So has landmine victims on the left, domestic violence, flood-affected people, percentage of population below the poverty line, and if all of these are overlaid together, we can get hotspots of insecurity. So these are places where people are subjected to numerous of those 13 threats in any one location. So not a very sophisticated analysis, but points specific to specific populations and what they're vulnerable to. So this is being used by humanitarians in Cambodia to direct resources to the most vulnerable.